I want to go over some of those symptoms
Sure.
with you, doctor. Starting with fatigue as one as the hypothyroidism, which, as you said, is one of the main ones. They come complaining about how tired they are, they've gained weight.
Exactly.
Okay, so can we go through some of these?
Yeah, absolutely. So, you know, again, the fatigue and the weight gain are usually the two biggest complaints that I have. And I think those are because those are the most obvious complaints. Other complaints that people talk about are feeling really cold. You know, they're always wearing a sweater. They're feeling cold when everybody else is hot. Hair loss. You know, patients complain of the hair falling out, hair thinning, dry brittle hair, dry nails as well. The nails can break a lot. They also have constipation. And again, a lot of these are because everything is going slower in the body. And so your hair is turning over slower, your skin is turning over slower, your intestines are moving slower, which is why you get constipation. Importantly, also, women can have issues with the period. So that's something that we don't always think about, but irregular periods is a symptom of hypothyroidism as well.
Now, let me ask you, this is a question I have, looking at those symptoms and hearing you speak. It sounds like some of this is very similar to being anemic.
It's true. It's very true. And I think some of the most difficult things for patients is that a lot of these symptoms can be nonspecific and can overlap with other things, such as anemia.
Right.
And so that's something else that's important. When you have symptoms of hypothyroidism, it's not a guarantee you have it. It's important to check other things. And that's one of the things that I tell patients if I do their blood work. And everything is totally normal, but they're still not feeling well, you know, go back to your primary care. Make sure they're testing you for other things. Make sure you don't have anemia. Make sure your iron levels are normal, and don't stop, because if you're not feeling well, to have a full evaluation and make sure that there's nothing else going on. But that's a very good point.